and looking forward to working closely with you and your team in the next 5 years. Thank you.
Fiji.
Thank you, Chair. Fiji offers sincere congratulations to Dr. Kasai and the Japanese government for great success today. I want particularly to acknowledge the participation of women candidates in this particular election. I look forward to more similar candidates in the future. I also thank those that participated, a team of highly qualified candidates. Unfortunately, only one has to come through, and it happens to be Japan this time around. God bless you all.
Tuvalu.
Thank you, Chair. I would like to join the others to say thank you to all the candidates who came all the way until today. And this is the result, as we know that only one can make it to the top. So congratulations on all your efforts. And to Kasai, we are looking forward, the government and the people of Tuvalu, we can work together in the next 5 years and see how we go forward from the small island state issues. Thank you.
Vietnam.
We will appreciate all the efforts and capacity of all the candidates, and as a good selection, congratulations to Dr. Kansai. And on this opportunity, I would like to thank to Dr. Kansai for the great contribution to Vietnam when he worked in Vietnam for the 4 years for the health sector of Vietnam. Thank you.
Vanuatu.
Thank you, Mr. Chair. On behalf of the government of Vanuatu, we join the other member countries to congratulate Dr. Kasai and also thank the other members of the interested candidates who also took part in the election today. Thank you very much.
Niue.
Thank you, Chair. I came here today to do a victory chant, but sadly, you will not be able to say it. Thank you, Dr. Kasai, for attaining the post, a very important post. Hoping that you will help all of us in the region. Congratulations from Niue.
Hong Kong, China.
On behalf of Hong Kong, China, I would like to congratulate Dr. Kasai, and we look forward to working closely with you in the coming 5 years and the promotion of health for the region. Thank you.
Macau, China.
Macau likes to join everybody on the floor to pay congratulations to Dr. Kasai and Japan, and we'd like to work with you for the next 5 years. Thank you.
Thank you. I see there are no further interventions from members of the committee. I would now like to invite the Director General to make some remarks. Director General takes the floor.
Yeah. First of all, I would like to congratulate all of you because you have a new regional director now. And I believe that you will give him your support so he can be successful in what he promised he will deliver during his presentation. So I think the first round of congratulations is to you. And then to Dr. Kasai, I think for the hard work and for winning this election and for being the new RD for this region. I have confidence in you. I have met you. I have worked with you now for the last more than 1 year. Of course, today we had very strong 4 candidates, and the competition was hard, as you have already seen. But Dr. Kasai, I know, can do a very, very good job. And I also believe that, as you have seen in the presentation, most of the priorities are aligned for this region and what we're saying as GPW. And as many of the member states have already said, the alignment between the headquarters and the region is very important. and I see no problem from his presentation. He stressed the alignment and for WHO to work as one. So I wish you all the best and look forward to working with you very closely and to deliver better to all the member states of this region. So all the best. And I would also like to congratulate Japan, because the success or the victory is not only for you, but also for Japan. So congratulations and look forward to working with you closely. All the best. Thank you.
Thank you, Dr. Tedros. I would now like to invite the regional director to make some remarks.
I have no remarks. Well, it is a surprise. I'm supposed to be totally outsider for this process. But again, I know all of these 4 candidates. Somehow we've been working together certain times, some many years or some short period, but all they are qualified person. I really appreciate your hard works and then your commitment, love for our region. I think especially Dr. Kasai, he's been working with me as DPM last for 4 years. And I know that he's a very sincere person and hardworking, sometimes very tight too. But I think this is good for the whole this organization. I think we certainly will succeed, and our legacy built in by all, not only me, but with the whole predecessor regional directors, and then also staff working here for a long time. Again, really congratulations, and then all candidates, Suzy, Narima, and then Colleen is not there, but all you done job well done. Thank you.
Thank you, Dr. Shin. I would now like to invite the nominee back to the podium to address the committee. Dr. Takeshi Kasai, you have the floor.
Okay, very high. Looks very high because there's some board here. But thank you very, very much for your trust and support. And I also wanted to thank Government of Japan through His Excellency Minister Nemoto for very, very strong support in the past 6 months for this campaign. And I also wanted to thank Dr. Shin Yun-soo. Actually, I served him 4 years, and that 4 years, I think, made me standing in this position. I learned a lot from him, how to manage this organization and how to change this organization. So I really also wanted to thank Dr. Shin for that. Nominated by the government of Japan, but I also get my wife's permission to start this campaign. And actually, you saved my personal life because today is my wedding anniversary. So now I'm happy to go home to report the result. Now I feel very heavy responsibility, but I think I can go through with this. Why? Because as I mentioned, after 6 months of campaign, visiting countries and receiving a lot of advice, I think that is the wisdom now I have in my hand. That's one reason I think I can go through with this challenge. Another reason is that we have a very good team here in this regional office and in the 15-country office, which again, Dr. Shin brought us up to here. And another reason is I met so many good leaders and I already mentioned in my speech, why I decided to run is remembering all those faces, and I thought I should run because there are so many people who I wanted to work with. Actually, some of those faces are in the opposite side, but still that's okay. Now, I wanted to congratulate all our fellow candidates. I think we did a very open and fair and transparent elections campaign. So I wanted to congratulate ourselves, Susie and Corinne and Narima. So thank you very much for that. And then I wish you all the best for that. Now, next year, Japan is hosting a World Cup. Don't expect me to say something different. But I learned that in the rugby, there's a concept called no side. So that once the game is over, the referee would whistle, and sorry, I lost my English, blow the whistle. And when you hear that sound, that means no side. And that signifies that from that moment, how fiercely you fight in the field, you come together and commit for the solidarity, or even those players to become a close friend. Now the game is over, and I really wanted to, again, work together. Because, as I said, it's my experience, during the emergency, we need to be united. And also, the focus I share, and this is the focus, again, I received from the leaders, is the shared challenges. And then it is much more effective and stronger if we work together and set up the platform, issue-oriented, problem-solving platform. So I wanted to unite, and I wanted to fully commit that we'll make a approachable WHO and trustable WHO so that we can continue to work together. So thank you very much for your trust. It's a starting, but I still have to work 2 months for DPM. I'll do my best for that part. And then after, it's a start. And as I promised, I'll function from day one. And I promise the country-specific approach means we pay attention to all countries, regardless of the size of the country and the stage of development. So I pledge for that. And thank you very much again for your strong support. Thank you.
Thank you, Dr. Kasai. This concludes consideration of item 7, and you now deserve a 15-minute coffee break.
Well, very good. Well done.
That was amazing. Good afternoon. We now move to agenda number 4, addressed by the incoming chairperson. Distinguished representatives, thank you for giving me the opportunity to address the regional committee. Honorable ministers, distinguished representatives, Dr. Tedros, Director General of the World Health Organization, Dr. Shin Yeon-soo, Regional Director, World Health Organization, Western Pacific Region, representatives of the United Nations agencies, intergovernmental organizations and non-governmental organizations, distinguished colleagues, ladies and gentlemen. Thank you for the trust and confidence in electing me to chair this 69th session of the World Health Regional Committee for the Western Pacific. The positive and free-flowing successful outcome of the vote to nominate Dr. Kasai demonstrated our ability to work together for good outcomes. I thank the outgoing chairperson, Ms. Glenis Butchap, and Vice Chairperson, the Honorable Minister Tautai Agikimwa Kaitu from the Solomon Islands, and other officers for the last session. I will do my best to follow the excellent example and to manage our program well. Distinguished colleagues, we had yesterday afternoon the excellent report of the Regional Director on the progress that has been towards better health in the region over the past 12 months. Thank you, Dr. Shin. Accordingly, it is time for a renewed approach and commitment to tackling NTD elimination, which is proposed in the new Regional Action Framework for Control and Elimination of NTDs before us this week. Our second technical agenda item is on rehabilitation. As all of us here know, health systems are under pressure from the rise of non-communicable diseases such as stroke and diabetes, and for some countries, this coupled with the challenge of aging populations. To respond to these challenges, we need to ensure that the rehabilitation is part of the universal coverage and the continuum of care for everyone. To restore health and well-being while recovering from illness or injury and managing long-term health conditions. Rehabilitation allows people to maximize their daily functioning, to manage basic essential skills such as communication, mobility, and self-care. The benefits of rehabilitation extend beyond basics to other areas of life, such as education and employment. In other words, as well as the benefits for individuals and their families, the community as a whole benefits from rehabilitation as people managing long-term illness, impairment, and disability can more fully participate in society. The proposed action agenda on strengthening legal frameworks for health in the SDGs provides a clear guidance and presents options for countries to consider in their efforts to prioritize areas for action, to improve processes for developing, implementing, and evaluating laws for health, and to enhance capacities of all stakeholders involved. Our fourth technical agenda item is about harnessing e-health for improved service delivery. E-health is the use of information and communication technology in support of health and health-related fields. It has the potential to revolutionize health service access and quality and can help in containing costs. Therefore, e-health can advance countries' progress towards universal health coverage. Countries face different challenges in implementing e-health initiatives. For some, the technology is developing rapidly, and many e-health pilot programs have been initiated but not scaled up. Other countries lack the capacity and ICT infrastructure to get e-health initiatives up and running in the first place. To maximize the potential of e-health, countries should prioritize e-health applications that benefit health services for the whole population. For those countries just starting out on their e-health journeys, ensuring the foundations, the regional action framework on improving hospital planning and management in the Western Pacific that will be considered by the committee this week offers a menu for action across different areas of hospital policy to reform the member states can adapt and implement based on their own context and needs. In addition to these important technical agenda items, we will also consider progress reports on a range of critical issues for health in our region: health security, non-communicable diseases, environmental health, and communicable diseases. We will also discuss a range of other important standing agenda items, including the coordination of the work of the World Health Assembly, the Executive Board, and the Regional Committee, and the agenda for the next year's session of this committee. Excellencies and distinguished delegates, thank you again for your confidence in electing me as chair of this very important meeting, and I very much look forward to our conclusion of this important regional meeting. Thank you. We now move to Agenda 14, Harnessing e-Health for Improved Service Delivery, document WPR/RC69/8. May I request the Acting Director, Program Management, to introduce this item.
Thank you, Chair. Distinguished representatives. I'm pleased to present document WPR/RC69/8 on harnessing e-health for improved service delivery. In 2015, Member States supported a resolution on accelerating progress towards universal health coverage and the Sustainable Development Goals. Service delivery is the visible face of UHC. At the same time, countries in the region have experienced rapid but uneven growth in access to information and communications technology, with internet and mobile networks being the most widespread applications. Electronic medical and health records and mHealth solutions are increasingly used for interaction and information sharing. The use of health informatics, big data, artificial intelligence, and robotics has also spread quickly. While many e-health pilot programs have been initiated in the region, they've not been scaled up. Nevertheless, many valuable lessons have been learned. Those lessons have helped inform the new draft Regional Action Agenda on harnessing e-health for improved health service delivery in the Western Pacific. The development process included intensive consultation with member states, experts, and partners over the past year. The Action Agenda takes stock of developments across the region and provides a systematic framework for deployment of e-health for improved service delivery. The Action Agenda provides practical guidance on how e-health can improve access to and quality of services in a cost-effective manner, which will assist countries in updating national e-health strategies for service delivery improvements. The Action Agenda encourages countries to prioritise how e-health is applied to improve service delivery and lay the appropriate foundations and enablers. These include ICT infrastructure, information sharing, and privacy and security mechanisms, as well as levers that support system adoption of e-health implementation. The Regional Committee is invited to consider for endorsement the draft Regional Action Agenda on harnessing e-health for improved health service delivery in the Western Pacific. Thank you, Chair.
Thank you, Dr. Jacobs. We will hear the representatives who wish to speak on this item. Brunei Darussalam.
Thank you, Chair. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and a very good afternoon. Mr. Chairman, fellow delegates, ladies and gentlemen, Brunei Darussalam is committed to leverage on technology for the improvement of healthcare in Brunei. In this regard, the Brunei Darussalam Healthcare Information and Management System, or simply called BRUHIMS, was implemented in November 2011, which transformed Brunei healthcare system from the traditional manual record system to an integrated electronic and online healthcare system, or eHealth, that links to all government-run health facilities to provide each patient with one patient, one record. 95% of our population are registered with this system. As such, Brunei has experience in implementing an integrated healthcare system that is not only used by a single hospital, but linked to multiple health facilities with a 90% national coverage, taking advantage on the small size and population of Brunei. At the population level, Brunei is looking at shifting the use of healthcare technology from measuring illness to measuring prevention and wellness. We are currently exploring how the wealth of data in Brunei or in BRUHIMS can be utilized, not only in monitoring, managing, and controlling the major cause of population health issues, but to provide intelligence, example, data analytics for policy development and nudging behavioral change in the community. One area of untapped potential with our eHealth system is the use of patient electronic data to develop individualized health profiles and predicted risk of developing diseases based on the existing medical information and individual risk factors. Using this, automated yet customized health advice can be delivered directly to the users. This could be made possible through the appropriate mobile applications or web portals accessible to the public. Health promotion at the fingertips can empower people to become active healthcare citizens by leveraging on mobile technology. Technology is an enabler that can allow people to have data and information to make informed choices about their health and can empower them to better manage their health care and treatment. With emerging health challenges and increasing demand for healthcare, we need to build partnerships in health using the tools that technology has provided us. Brunei Darussalam commends Secretariat for its presentations, and we endorse the draft Regional Action Agenda on harnessing eHealth for improved health service delivery in the Western Pacific. Thank you.
Thank you. I call on the representative for Malaysia.
Thank you, Mr. Chair. We would like to congratulate Wipro for the comprehensive regional action agenda on harnessing eHealth for improved health service delivery in the Western Pacific. We have reviewed and are agreeable with the recommendations and the proposed priority areas in this action agenda. Malaysia is also facing similar challenges as described in the report, and we strongly agree to the important role of eHealth towards achieving UHC. Digital health and innovation is one of the main focus in our health transformation roadmap. Malaysia has been strengthening in e-health strategy and technology adoption that is aligned to the national, social and economic transformation. The WHO ITU's National E-Health Strategy Toolkit published in 2012 listed the minimum components needed for successful national e-health strategy. The action agenda has addressed the above in a comprehensive manner based on the 4 groups of member states. It also provides a systematic framework for deployment of e-health for improved service delivery. We believe that in resource-constrained settings, investment should be made in mHealth. Investments in other aspects of digital health, for example, EMR, EHR, big data, artificial intelligence, require substantial investment. Regulatory framework, enabling ecosystem, and skilled workforce are important in this age of digital disruption. Malaysia recognizes the success of digital health requires partnerships and strategic collaborations, specifically multi-sector involvement. We encourage WHO to support member state participation in regional multi-sector networks and collaboration with development partners to further build capacity and capability in health. Finally, Malaysia endorses the Regional Action Agenda on harnessing e-health for improved health service delivery in the Western Pacific. Thank you.
Thank you. I call upon the representative of Macau, China.
Thank you, Chair. To keep pace with the time, Macau Health Bureau has been investing resource in e-health by carrying out related projects. Currently, most of the major medical institutions in Macau have successfully deployed different kinds of electronic medical services system. For example, electronic medical record, PACS system, electronic prescription, electronic laboratory reporting system. As a result, medical staff can review and modify patient records, prescribe and review different kind of report through the computer system. All the systems are alert features with alert features such as a drug alert, a drug interaction and maximum dosage, etc. They are implemented to use various advanced technologies such as RFID, smartphone, a smart ID card, electronic signature, smartphone apps, etc. to develop related services. These projects are aimed to feminist and paperless environment and, of course, save the earth. Based on this foundation of electronic system, the Electronic Health Record, EHR, was released last year. The goal of this project is to make all the data from different medical institutions in Macau be connected. As a result, medical staff from different institutions can access patients' virulent medical records, which are placed in other connected institutions under the patient's authority. Therefore, the medical staff can obtain more complete health information in order to make a more accurate diagnosis. This system also helps to prevent medical overdose and repeated inspection. The entire project will be implemented by phases. The first phase starts with a pilot project that connects government hospitals, health center, and private hospital. Since Macau has implemented Personal Data Protection Act, our citizen needs to register before joining the project. When the patient is doing the medical visit, they also need to present their smart ID card as an authorization for the medical staff to access their medical records, which are placed in other connected institutions. In the future, the project will extend to private clinics, pharmacies, and other medical institutions. 2 years ago, the Health Bureau from Macau deployed a project called My Health Depends on Myself project. The Health Bureau set up different kind of measure facilities in various health centers and communities, which encourage the public themselves to measure their blood pressure, height, and weight for self-monitoring their own health initiative. In addition, if the citizens agree to transfer their self-monitoring data to the Health Bureau, they will be stored in our database for reference in the future for medical visit. The data mentioned above can also be entered by the citizens themselves via the mobile apps. Thank you very much.
Thank you. I call on the representative of Australia.
Thank you, Chair. Building digital health capabilities has the potential to bring far-reaching benefits for us all, empowering individuals for better self-care and providing innovative solutions for health professionals. It will be a key mechanism for us as we progress towards universal health coverage, and it offers huge potential for us to face the challenges of a rapidly ageing population. This is a domestic priority for Australia and a priority for our engagement in the Western Pacific region and throughout the world. Australia supports the Regional Action Agenda. We acknowledge the differing levels of e-health progress in our region, and the document properly makes separate recommendations for countries at different stages of e-health development. However, consideration should also be given to how e-health itself can help accelerate the health agenda of countries with developing health systems. WHO technical support and guidance, including tools and information standards on e-health, will remain important in our region into the future. Australia is in the throes of a major step change in e-health. More than 6 million Australians already have a digital health record under our My Health Record program. But by the end of this year, all Australians will have a My Health Record unless they expressly choose not to have one. This is expected to include more than 90% of Australians. We are keen to share our learnings about the process with interested member states. A number of countries are already engaging with us in an international dialogue on policy design and practical delivery of digital health services. This includes through the Global Digital Health Partnership, which met for the first time in Australia this year and which currently involves 17 countries. We welcome a continuing discussion with all interested countries. Thank you.
Thank you. I call on the representative of Philippines.
Thank you, Mr. Chair. The Philippines notes with appreciation the draft Regional Action Agenda on harnessing e-health for improved health service delivery in the Western Pacific. As a member of the Joint Learning Network, the Asia eHealth Information Network, and other peer-to-peer learning networks, we support the official participation of countries in international networks, alliances, societies, groups which could provide guidance, technical assistance, learning and knowledge exchange, and other resources for strengthening national health information systems and civil registration vital statistics for financial and social risk protection. We request WHO and development partners to provide technical support for initiating, building, and maintaining the requirements proposed by the WHO ITU National eHealth Strategy Toolkit in specific areas such as governance structure for private and public sector coordination for national health information systems, capacity building for health information standards to meet commitments for financial and social risk protection, and health technology assessment for biomedical devices and other e-health solutions. We propose that metrics for defining recommended e-health services at different levels of care be determined to outline appropriate e-health solution necessary to support service delivery networks. The Philippines is grateful for the assistance received for the crafting of the Philippine National e-health Strategy and Plan in 2013. We deem that appropriate guidance from globally accepted frameworks and tools is most essential to meet our country and regional commitments towards instituting service delivery networks and universal health coverage. We hope to actively engage in alike consultations to finalize the Regional Action Agenda on e-health for improved health service delivery networks in the Western Pacific. Thank you, Mr. Chair.
I call on the representative of Singapore.
Thank you, Mr. Chair. Singapore would like to commend the Secretariat for its efforts in drafting the Regional Action Agenda on harnessing e-health for improved health service delivery in the region. Reiterating the sentiments of the draft framework, Singapore appreciates the challenges identified, as well as the benefits that ICT can bring to universal health coverage and improving service delivery. Over the last decade, we too have been identifying ways to improve universal health coverage through the incorporation of strategic e-health initiatives. In addition, we have sought to improve the patient experience and reduce care fragmentation. Now allow me to elaborate. Over the last few years, one large tranche of work which Singapore has invested in is the development of a national integrated health data platform. This intent is to link patients, their medical data, the providers, and the relevant systems together to enable the seamless sharing of information and facilitation of continued care to enable patient mobility within our healthcare ecosystem. At the national level, we implemented the National Electronic Health Record or NEHR in 2011. The access to clinical information helps healthcare professionals make informed decisions for care provision and enhances service delivery through the minimization of wastages of services such as laboratory tests. At the individual level, patients are empowered to manage their own health through NEHR information made available through personal accounts in an online app which we call Health Hub. Now, expanding upon the established networks of linked systems and the wealth of patient information has enabled us to implement other initiatives such as telehealth and enable the use of analytics to derive insights for population health management. Now, on this journey, we have faced many challenges, and to name just a few, we have had to enhance adoption through re-engineering of new work processes, address public concerns regarding privacy and confidentiality, implement adequate measures to ensure that the information is kept secure and accurate, and all of this in a dynamic and live environment. It hasn't been smooth sailing, and we will continue to address challenges, but there is much more for us to learn and improve upon. Now, in closing, ICT presents great opportunities in achieving UHC, and Singapore supports Wipro's efforts in this area. Now, as we embark on this journey, I believe that we have much to learn from one another, and we will be happy in Australia to share our experiences wherever we can. And with this, we endorse the Regional Action Agenda presented before this meeting. Thank you.
Thank you. I call on the representative of the United States of America.
Thank you, Chair. The United States welcomes the Regional Action Agenda on harnessing e-health for improved health service delivery in the Western Pacific and regional efforts to increase the use of digital technology to enhance health service access and quality and contain costs. We support WIPRO's efforts to encourage member states to strategically integrate digital technologies into country health activities, to extend the reach of service delivery and improve the quality of services through the use of electronic health records, telemedicine, and mHealth platforms. The U.S. strongly supports the creation and operationalization of national digital health that reflect nationally supported digital health strategies and identify how the integration of digital information communication technologies, ICTs, can support member states' health goals. E-health in the region is rapidly developing through the integration of electronic health and mobile phone-based mHealth digital information systems. It is clear that communication technologies will help overcome traditional obstacles to health service delivery and improve access, quality, and health resource allocation, as well as lower costs to the patient. We appreciate the identification of components needed for a digital health enabling environment, including capacity building, governance standards, interoperability, and data privacy and security, and encourage country-level digital health policies to prioritize support for those components. Finally, we urge member states to adopt the principles for digital development and to apply this to their own national programs. Thank you.
Thank you. I call on the representative of Cambodia.
Thank you, Mr. Chair. Cambodia has made improvement in the field of e-health in recent years, driven by both the health sector itself and by the growth of information and communication technologies. The government of Cambodia strongly supports and facilitates the use of ITC to improve health, increase access to services, and increase availability of competent health training institutions, as well as exploring innovations in looking at how trend of increasing technologies advancement can support with delivery of qualities, including providing providers with accurate and timely information to make decisions and improve case management as patients move through the continuum of care. The health information systems in Cambodia capture disease and surveillance record, consultation and admissions, preventive services, regional program data, death and birth record, and population data from public health facility and all private health service provider to very limited extent. Health facility data is a critical input into access, progress, and performance of the health system on a regular basis, and it provides the basis for national, provincial, district, and facility performance assessment. E-health instruments such as telemedicine and the use of mobile apps to collect data are not in the widespread application in Cambodia. Despite the progress made, there is still a scope for improvement. These include, but it's not limited to, maintaining the high data quality, institutional capacity development of data analysis and use, and increased investment in IT to support the current initiative on integration and harmonization of different database systems, including disease surveillance and response system. And also to integrate and improve interoperability of the data collection system and use the e-health platform to improve data collection and use, in particular at health facility level to improve referral mechanism and support outreach to communities. To do so, the governance issues related to increased use of e-health remain to be addressed, such as data privacy for patients and securing sensitive information. The Ministry for Health Information System Strategic Plan 2016-2020 outlined a way forward for health information in Cambodia that encompass e-health. Measures identified in the regional action agenda, such as implementing a unique identifiers and ruling out electronic prescribing and the medical record are highlighted as a priority in the strategic plan. The national e-health strategies are proposed in the regional action agenda could be a useful complement to the Cambodian Health Information Master Plan. Cambodia joined the previous member state to support the draft regional action frameworks, and we wish to express our appreciation to the ongoing support of the WHO in the process to build the capacity of the hospital staff in ICD-10 in order to improve the mortality and morbidity and morbidity statistics. We also would like to request WHO and the other member states to support Cambodia in the development of the health strategy. Thank you, Mr. Chair.
Thank you. I call on the representative of the Republic of Korea.
Thank you, Mr. Chair. First of all, on behalf of my government, I would like to appreciate the valuable efforts of the Secretariat that have presented for endorsement by this committee the important document, namely the draft Regional Action Agenda on Harness e-health for improved health service delivery in the Western Pacific. My delegation fully agrees to the points made by the Secretariat in the draft, that if well established and implemented in line with each country's context, e-health can be an indispensable and powerful means of improving access to quality healthcare, expanding USC efficiently, and increasing the cost effectiveness in healthcare services, particularly under the ever-increasing healthcare demands at the age of aging society. Having said that, I would like to briefly mention about Korea's efforts to make the most of e-health application, particularly electronic health record, EHR. The Republic of Korea has made ongoing efforts to integrate ICT into the overall flow of the healthcare system, aiming to increase its efficiency and sustainability. Korea enacted the Medical Care Act in June 2017 that promotes the standardization and certification of EHR and develops an information sharing system linking hospitals across the country. Encouraged by this government initiative, hospitals at all levels have shown a keen interest, and the number of hospitals participating in the information sharing system is on the constant rise. We expect the exchange of the standards, the EHR between hospitals will bring many benefits to our healthcare services. For instance, the system will strengthen patient safety as easy access to previous patient records, improve a continuum of care for each and every patient, preventing adverse drug events, and enabling a rapid emergency response. Also, the system will reduce healthcare costs by minimizing redundancy in diagnostic imaging and testing. Furthermore, it will enhance patient convenience through an electric transfer of medical and health records rather than previous hand delivery of them. In addition, Korea plans to introduce national standards to certify qualified EHR. This certification system aims to support the speedy exchange and use of EHR between healthcare facilities and increase the quality of such data. In conclusion, since a well-established and operated EHR, has a variety of promising benefits to meet ever-increasing healthcare demands at the age of aging society. The Republic of Korea is a staunch supporter for introducing e-health in the unique context of each country across this region. Accordingly, my delegation full-heartedly endorse the draft Regional Action Agenda on Harnessing e-health for improved health service delivery in the West Pacific region, which is in front of us. Thank you for your attention.
Thank you. I call on the representative of Samoa.
Mr. Chairman, Samoa supports the Regional Action on Harnessing e-health for improved health service delivery, which proposes a stepwise approach to longer-term e-health development, indicating suitable strategic investments based on our priorities and needs. In recognition of the calls for action made over the years by the Pacific Health Ministers' meetings and the Samoa Pathway, we have launched our e-health policy and strategy 2017 to 2022, which sets out our e-health agenda, and that has entailed the complete overhaul of our health information system and information communication technology, given current national developments. Strategically, the plan is underpinned with the principles of accountable governance in health, sharing and accessibility of health data and information, as well as appropriateness, thus ensuring that the e-health encompasses components shall be of appropriate standard to ensure confidentiality, security, integrity, and availability of health information. Samoa concurs that e-health needs to be implemented using multi-sectoral approach given our small population size. Thus, our national ID project is also underway, and this will allow our health sector to obtain unique health identifiers required for our health information system to alleviate duplication issues. Given the standards, the hard lessons learned from having fragmented systems, health, workforce inadequacy, and limited resources, Samoa strives to make use of this opportunity by ensuring that our e-health delivery program is clinically led. To support small islands, countries like ours, we encourage the WHO to continue to enhance their patronage through the Pacific Health Information Network, regularize trainings for end users like clinicians, and to coordinate regional forums, such as an annual digital health program. This could initiate and pursue the sharing of e-health information, digital medical innovations, experience, and regional capacity building requirements. I thank you, sir.
Thank you. I call on the representative of Micronesia.
Thank you, Chair. Federated States of Micronesia endorsed the agenda item Harnessing e-health for Improved Service Deliveries. Telemedicine, information communication technology, e-health, telemed, telepathology, these are fancy words to me as a non-technical person, and whatever the meaning is for a policy person like me, especially in the remote island setting, its application is more important. For example, how can a village or an island health care worker connect via radio, internet, even live consultation to have skills or knowledge to help their patients? At our hospitals, where our doctors need to consult with specialists, the use of this technology is even more pronounced. The time it takes to send our specimen to reference laboratory takes too long for many of our small islands. With the advancement in technology, there's got to be a better way to bridge this digital gap in order for our local health workers to gain the knowledge, skills, and professional advice in dealing with medical conditions. On behalf of the Department of Health, Federated States of Micronesia, I would like to thank government of Japan to allow us to work with one of its medical institutions, Hokkaido Cancer Research Center, to have access to its experts and resources for telepathology. This has contributed immensely to our ability to diagnose our patient treatment plan to our people, especially patients with cancer. The need for us in this area is enormous, and we support the work of WHO is doing to advance this important technology to improve health. And we look forward working partnership with our developing partners in this undertaking. And I thank you, Chair.
Thank you. I call on the representative of China.
下面我们请中国代表发言。Thank you, Chair. E-health is playing an important role in measuring and promoting health-related SDGs and achieving UHC. We appreciate the report prepared by the Secretariat. We support WHO playing a leading role in developing and implementing e-health. As for the draft action agenda, we have the following comments. First, we agree that the e-health technology development and application requires wide cooperation, as mentioned in the draft action agenda. However, we want to reiterate the cooperation with the private sector must be carried out under FENSA. And the report has provided different options for different types of countries. This provides a good reference for guiding the work at the subnational level. We hope that such a categorization can be more detailed and can be adjusted dynamically according to the actual situation. The report has also mentioned e-health literacy. Literacy is very important for countries facing aging. E-health technology development requires infrastructure. We hope that World Health Organization can help developing countries with the infrastructure. We stand ready to cooperate with WHO and other member states in infrastructure. We support the adoption of the draft action agenda. And I would also like to take this opportunity to share China's experience. First, at the national level, China attached great importance to the e-health. Healthy China 2030 program has been released, and the guidance on the development of big data for e-health has also been published. We also published opinions on the Internet Plus Health. And the National Health Commission also attached great importance to the e-health. We have published the guidelines on the development of the population health information platform, and the e-hospital standards and norms has also been released. More than 200 requirements were put out. And we have launched a campaign to make the service more equitable, convenient, and inclusive through e-health. China is dedicated to global cooperation, and we shoulder our responsibilities. For a long time, WHO has played an important role in coordinating global health. China appreciates that. Within the framework of UN, WHO, China will continue to participate in global health to provide assistance to other developing countries within our capacity. Thank you.
I call on the representative of Japan.
Thank you, Chair. Japan considers that utilizing e-health is necessary for countries to achieve UHC. Accordingly, we support WHO's efforts to promote strategic efforts to improve e-health policies at country level. Thus, we strongly support the Regional Action Agenda and the draft resolution. E-health is a key contributing factor for UHC, and thus Japan supports to push this agenda forward. We had a very difficult time analyzing the consolidated data due to low compatibility of the electronic health records. To avoid the same situation in countries which will introduce e-health systems, from now, we request WHO to support member states to introduce e-health in a strategic manner and enhance cooperation and knowledge sharing amongst the member states. Thank you.
Thank you. I now invite the representative of the Lao People's Democratic Republic.
Thank you, Mr. Chair. Laopedia agrees that e-health can make a major contribution to advancing universal health coverage by improving access to and quality of health services and lowering costs for patients, service providers, and systems. With the support from WHO and UNICEF, Laopedia is initiated the development process of an e-health strategy that fully complies with the WHO recommended process. The draft document has been translated to Lao language, and its relevant sections have been incorporated into the Health Information System Strategy 2018 to 2020 that was approved in December last year. One of the key areas of the draft e-health that has already been applied since 2014, particularly in the area of the ICT application, is the development of the web-based graduate integrated HIS on DHIS2, applying to concept of e-health to HIS. This integrated platform has enabled to the Ministry of Health to set up and collect data to monitor USC, SDG at central and subnational level. Laopedia will require additional support with practicable actions to further strengthen and institutionalize e-health implementation and capacity building, and engage with clinicians and end users at district and village level, as well as improvement in the quality of data collection and reporting processes. Sharing of good practice and information on health information systems from other countries will be useful. In conclusion, Laopedia endorses the draft Regional Action Agenda on harnessing e-health for improved health service delivery in the Western Pacific. Thank you, Mr. Chair.
Thank you. Due to time constraints, may I seek your agreement to postpone or defer further debates on this subject to tomorrow? At this point, may I call on the Director Administration and Finance for the administrative announcements.
Very much, Chair. Just a couple of quick reminders. Transport back to the Manila Hotel and the Rizal Park Hotel is available at the drop-off at the end of today's session. And tonight, the RD will host a dinner for all participants at the Manila Ballroom of the Manila Hotel. Welcome drinks start at 1800 and dinner at 1830. Transportation for those of you staying at the Rizal Park Hotel will be operating from 5:45. And then a reminder, tomorrow's session begins at 9 a.m. So you don't have to come so early today as today. So 9 a.m. tomorrow, please. Thank you very much, Chair.
Thank you, Mr. Kobza. The committee will reconvene tomorrow at 9 a.m.